So I'm going to talk, Phil's introduction was perfect for this because I'm going to actually change a little bit and really talk about what's the utility of PSMA in the diagnostic setting and also as a predictive or prognostic biomarker in patients with prostate cancer. So I'm going to go in 10 minutes through three quick topics. The one will be kind of what additive information or does it provide PSMA imaging provide when compared to MRI, which is, of course, our standard for cancer detection nowadays. The second will be PSMA PET. What do we know about it as a predictor or prognostic marker of outcome? And then some newer work from my current SUO fellow, Adam Weiner, on PSMA as a biomarker of tumor biology and treatment response. So Phil already introduced this, diagnostic sensitivity at the time of surgery, about 40%, so I won't belabor that one. So this is a paper from a few years ago really looking at the sensitivity of MRI for detection of primary prostate cancer. And as you can see, and this was somewhat controversial when we published this because there were people saying that MRI was perfect, diagnosed 90% or more of all prostate cancers. But clearly there were a lot of tumors that were not visible by MRI. You're going to hear a lecture from Lori Klotz tomorrow about kind of what's the meaning of invisible, MRI invisible cancers, and oftentimes they are smaller, they're oftentimes less aggressive biologically. So the question though is, can PSMA kind of can it be synergistic, can it be additive, can it replace MRI? So there's a few papers that have been published so far on this. So this is a paper from Australia, from Yaxley's group, really large study where they actually looked at the sensitivity of PSMA versus MRI for the index lesion. And in this pretty large study, including many patients who had a Gleason score of 3